Good afternoon, everybody. Can everyone hear me okay?
Yes, I can hear you.
Okay, perfect. Thank you for joining us today during your lunch break to review the results of our statewide data validation project of MRSA Bacteremia LabID events for the year 2022. My name is Cassie Primich. I'm one of the 3 validators who worked on this project, and I'm joined today by my fellow validators, Yojin Lee and Yasa Bagby. We are so excited to finally share this presentation with you today. Next slide, please. A couple of housekeeping items. This webinar will be recorded and shared with the attendees along with slides. All attendees will be muted upon entry. If you have any questions during this webinar, feel free to use the chat function. And lastly, if you are unable to access the chat, use the raise hand function to be unmuted by the host. Next slide, please. As a brief overview, Centers for Disease Control and Prevention National Healthcare Safety Network, or NHSN, is the nation's most widely used healthcare-associated infection tracking system. Healthcare-associated infections and antimicrobial resistance program here at Virginia Department of Health conducted external validation of MRSA Bacteremia LabID events reported by acute care hospitals in Virginia during calendar year 2022. The data validation was conducted by 3 trained validators to review and evaluate facility surveillance practices, methods, data completeness, reporting accuracy in a non-regulatory, confidential manner. External data validation can help assure adherence to NHSN specifications for HAI reporting by identifying and correcting those shortcomings that would be difficult to address through internal validation alone. Next slide, please. So as a little background, the bacteremia Staphylococcus aureus is commonly found on the skin and the nose of healthy people and does not cause disease unless it enters an opening in the skin. MRSA is a type of Staph aureus that is resistant to several antibiotics, making it difficult to treat. MRSA most often spreads by direct person-to-person contact with an infected wound, contaminated hands, objects, or environmental surfaces. Invasive cases of MRSA are often healthcare associated and can cause severe problems, including bloodstream infections, pneumonia, surgical site infections, sepsis, and death among high-risk individuals. MRSA infection can also spread outside of healthcare settings. CMS, or Centers for Medicare and Medicaid Services, requires acute care hospitals to report MRSA blood specimen LabID events to NHSN. Facilities reporting MRSA Bacteremia LabID event data must adhere to the definitions and reporting requirements as specified in the NHSN protocol. Acute care hospitals, outpatient hemodialysis facilities, long-term acute care hospitals, inpatient rehab facilities are all required to report the following HAI events to NHSN. And these events are central line-associated bloodstream infections, catheter-associated urinary tract infections, surgical site infections following either colon or hysterectomy procedures, MRSA Bacteremia LabID events, C. diff laboratory-identified events, and healthcare personnel influenza vaccinations. Next slide, please. So in the next few slides, we'll review the methods we used to conduct this project, and this is the timeline. In September, VDH sent communication emails and held webinars with hospitals regarding external validation. of MRSA LabID events for the calendar year 2022. During October through November, participating hospitals completed a REDCap survey and shared their line lists of positive blood cultures of MRSA with the DH. And then the case selection and case validation activities were conducted by internal validation specialists during October through December of 2023. And once validation processes were completed, VDH prepared individual facility summary reports and a statewide summary report in January and February. And those individual reports and recommendations were shared and discussed with IP at each hospital. Next slide, please. So there are 5 health planning regions, 35 health districts, and 78 acute care hospitals in Virginia. We selected 30 acute care hospitals from across the state for external validation in accordance with the CDC 2022 external validation guidance and toolkit and acute care hospital method 3 supplement for validation. Of those 16 acute care hospitals from 16 local health districts participated in the external, 16 local health districts participated in the external validation project. The participating hospitals provided information on their surveillance processes, practices, and laboratory-based line listing of positive MRSA blood cultures for the calendar year 2022 via, again, REDCap survey. And from the submitted baseline lists, we randomly selected up to 40 positive blood cultures of MRSA for each hospital to review. The total number of submitted cases from all facilities came up to 438. For example, some facilities may have had fewer than 40 cases. In that case, all cases have been validated. Next slide, please. We reviewed the selected cases for the correct application of NHSN MRSA BSI LabID criteria and compared to what was actually reported to the NHSN. We conduct coordinated case reviews with IP at each hospital, and at the end of the validation process, we met with the hospital IP staff and discussed findings and recommendations. All participated hospitals received a written summary report. And I will pass this over to my colleague, Yojin, for the next section of our presentation.
Thank you, Kathy. Can you all hear me okay? Okay, all right, great. All right, I'll start. So good afternoon, everyone. This is Yojin Lee. I'm going to review the results section with you. So as you can see, this map shows 16 participating hospitals in their respective health planning region. As you can see, all 5 Virginia health regions were represented, but you'll notice that only 1 facility from the central region participated, while 6 facilities from Eastern region participated. So there are some variances. Additionally, those participating hospitals represented 16 local health districts out of 35 of those. Next slide, please. So to table below, again, 16 hospitals participated in the external data validation project for MRSA Bacteremia LabID events. Those 16 hospitals represented 16 local health districts and 5 Virginia health planning regions. So a total of 438 cases were selected and reviewed by the VDH validation team. Of those, 421 cases were accurately reported according to the NHSN reporting criteria. So with that, the statewide accuracy rate was 96.12%, which was very good. So among those participating hospitals, we noted that 56%, there was 9 hospitals, had more than one discrepancy, and 44% had 0 discrepancy, which was very good. Thank you. And next slide, please. So in this table, you can see discordant cases between the VDH validation team and the hospital IP team. To give you an orientation about the table, the columns in blue box are the cases designated by the VDH validation team, and the red box shows the cases designated by the facility IPs. So in yellow box, you see the sensitivity and the specificity. So sensitivity means the rate of correctly identifying a positive MRSA blood culture that meet the criteria for reporting, as opposed to specificity means the correctly identifying a positive MRSA blood culture that are not meeting the reporting criteria. In other words, correctly identifying non-reportable MRSA Bacteremia LabID event. Next slide, please. So out of 438 cases reviewed, the validation team identified 338 reportable events. Of those, we noted that 15 reportable events were not reported in NHSN. So those 15 cases were missed the opportunity of identifying the reportable MRSA Bacteremia event by the facility. That represented 95.6% of overall sensitivity rate. Later on, we'll further explain about the most common errors we found for those underreported cases. Next slide, please. Again, out of 438 cases reviewed, 100 cases were non-reportable events, which means those cases did not meet the NHSN reporting criteria. We found that 2 of those non-reportable events were actually reported in NHSN, so that makes the overall specificity rate of 98%. With that, as a whole, the statewide accuracy rate was 96.12%. Again, there was 421 cases correctly reported over 438 cases reviewed. So that's the end of the results section, and I will hand it over to Yasa for the last section of this presentation. Thank you.
All right, good afternoon, everyone. Can you all hear me? Yes, all right, thank you so much. So as Yojin mentioned, my name is Yasa Bagby, and I'm the 3rd External Validation Specialist with VDH, and I'll be taking us through the rest of the presentation. So as we concluded the validation activities, there were a few things that we identified. The first being the most common reporting errors. The most common type of reporting error was missed opportunities of case findings, meaning cases were not properly identified and reported to NHSN, which resulted in underreporting of reportable MRSA Bacteremia LabID events for 2022. Some of those missed events were related to automated electronic surveillance systems issues, such as errors in case detection rules in electronic surveillance system used by the facility. And the second common reporting error type was over-reporting. It is important to note that there were only 2 cases of over-reporting of MRSA Bacteremia LabID event identified, which were due to misidentification of organism. For example, MSSA versus MRSA or MRSA. Next slide, please. So as we evaluate this phase of the validation activities, there are a few recommendations and key takeaways that we'd like to share. Firstly, Virginia hospitals can improve the participation rate in external validation projects to better reflect overall data accuracy for the state. Although all 5 Virginia planning regions were represented, only 1 facility from Central Region participated, while Eastern region was most represented by 6 facilities. Additionally, out of the 35 Virginia health districts, hospitals from only 16 volunteered to participate. So we hope to increase the participation rate in the future to improve NHSN data quality statewide. Next, Virginia hospitals could improve reporting accuracy of HAI data to NHSN, given that only 44% of the participating hospitals had 0 or no discrepancies. Another recommendation would be for facilities to conduct the denominator validation to improve their own reporting accuracy, given that a large majority of the facilities chose not to complete this section of the REDCap survey during the external validation. VDH also recommends facilities to conduct the patient care location mapping regularly, at least annually or following the NHSN guidelines. And then lastly, VDH recommends facilities to review the case findings and reporting rules in the electronic surveillance system to ensure all positive MRSA blood cultures are properly identified and submitted to NHSN according to the NHSN criteria. Next slide, please. All right, so we would like to share some resources with you all. The first set of resources highlights NHSN specific resources, such as the NHSN training webpage, where you will find self-paced interactive trainings, links to previous annual trainings, and resources for users new to NHSN. Next is the internal validation toolkit, which serves as a great guide for conducting data quality activities that are suggested to be conducted routinely by healthcare facilities to ensure that data reported to NHSN are accurate. The next document is the instruction for mapping patient care locations in NHSN. And as a reminder, this process should be followed when adding any new unit to NHSN for surveillance and should be repeated for any unit when there is a significant change in patient mix. For example, the merging of units or when a unit is taking on a new service. Next is the Patient Safety Component Manual, which provides instructions and standardized surveillance methods and definitions for each module of the patient safety component. And then lastly, we want to highlight the VDH HAI AR webpage that provides great resources for public health professionals and healthcare facilities. On that webpage, you will find trainings, statewide data, and statewide reports. The statewide summary report of this external validation of MRSA Bacteremia LabID event for calendar year 2022 has been posted and can be found on the website. At this time, we're going to go ahead and drop the link directly to the statewide summary report in the chat for you all. Just give us 1 second to get that there. Okay. And we can move on to the next slide. Okay, so we are gracious to have 2 infection preventionists that participated in the external validation project on behalf of their facilities join us today to share their personal feedback. First, we have Tracy San-Saucio with Augusta Health. Tracy, at this time, if you can unmute your mic, and when you're ready, you can go ahead and take the floor.
Thank you so
Thank
much.
you.
It's such an honor to be asked to do this. I really, really appreciate the opportunity. I'm sad that not more hospitals participated. We at Augusta Health take our responsibilities in this department so seriously and validate and revalidate and send out for review different questions that we have. And I can't stress enough how important it is to be able to have the partnership with VDH to have this external validation program. Again, we do our own internal validation with our lab partners, our micro partners. So every month I get a report for all of our MRSA and C. difficile LabID events, and I validate those in our DICON. We are a DICON hospital, Duke Infection Control Outreach Network. So I validate that everything is put in there correctly, that's attributed to the correct unit. And so we do that monthly. And just having the confirmation from you guys that we are doing everything correctly is such a load off of my mind. I take our responsibilities. We hold this job in high esteem, and it's so important that we do this information correctly. And anything that I can do to help champion more hospitals to join, I'm happy to do. So I'm happy to talk to other hospitals, to share our experiences and the importance of doing this. So just, let me know how you all can use me in the future, because it's so important. And you're such a joy to work with. So thank you for that as well.
Thank you so much, Tracy. And thank you for sharing that your facility conducts, internal validation on a regular basis. I think that's very beneficial and really speaks to what you guys are doing there at your facility. I just have one question for you. What part of the external validation activity would you say was the most beneficial?
The partnership with you guys, I thought it felt so normal and relaxed. I thought that was the best part for me. The survey, I thought, I answered some questions incorrectly. I would misunderstood the interpretation. So I think if we could do any kind of, change, the survey was a little, a little difficult for me to understand exactly what you were asking me to do. So that would be my only, caveat from that. But as far as the most important thing was actually just working with Cassie, it was lovely. It was like we'd known each other all our life. It was easy. We had everything ready. Our micro department had all the line list ready. She's excellent, our microbiologist. So everything was just flowed very easily. It was not a hardship. It was not labor intensive. It was just perfect.
All right. Thank you so much, Tracy. We really appreciate you being here today. Next, we have Chloe Lewis with Mary Washington Healthcare. And Chloe, at this time, you can go ahead and unmute your mic. And when you're ready, you can begin. Thank you.
Sounds good. Hello, everybody. I'm going to go ahead and share my screen. Looks like I am unable to share my screen due to presenter restrictions. I'll just go ahead and discuss some of what we collaborated with here at Mary Washington Healthcare. So we here at Mary Washington Healthcare had the opportunity to submit for both Mary Washington Hospital as well as Stafford Hospital. Definitely want to highlight the fantastic work that we partnered with VDH, submitting with Yogen as well as YASA. So thank you very much for those efforts. It's been such a fantastic opportunity just to get to know you all and pick apart this data and just see what we need to work on. So during this collaborative effort, just working with the two validators to foster access to Mary Washington security team to gain appropriate electronic medical records view. We've met several times here for particularly Mary Washington Hospital to kind of survey our data. What actually are we generating and how are we accurately reporting that out to NHSN, excuse me. The two opportunities and discoveries that we came across, the first being mapping. So within Epic, we have our Epic locations, and we wanted to ensure that we were mirroring those two accurately to NHSN with the unit codes and labels. And then the second portion of the mapping aspect is we grouped our emergency departments together. Since we do have separate freestandings, this allowed us the opportunity to individualize those locations, and then therefore, again, ensuring that NHSN reflects that accurately. The last part, we determined with the use of our Epic computerized electronic surveillance system, there were two missed opportunities due to the automation of direct reporting. So again, as our action plan that came around those two, we determined, again, mirroring what NHSN was capturing and what we were direct submitting from Epic, as well notating in our separate EDs, pulling those out, and showing which location was direct submitting and capturing those MRSA bacteremias. And then with our Epic direct reporting, we had the opportunity to just have a process in place to discuss and reveal how these lab IDs are being sent over, right? Do we have the correct transfer rules in place, and how are they being reported? So we discovered that we needed to include some of the correct reporting ranges of dates to capture the 14 days to allow for not only admissions, but also within the admission, the patient's collections are accurately reporting within those 14 days. So overall, it was a fantastic experience. We definitely enjoyed being able to, again, collaborate not just with our VDH partners, but with our EPIC teams, our micro teams. We do also validate monthly to look at all of our specimens that we submit through NHSN. And then we do circle back around quarterly to ensure that from those direct submissions, that were there any additional findings that we need to discover. So again, looking forward to partnering with on other HAIs that we submit over to NHSN. This has been a really great finding for us. You don't know until you ask, and we get in the thick of things to figure it out. And it's been a fantastic process, and look forward to working with you all in the future.
Thank you so much, Chloe. And you hit a lot of really good points there. Like one of the things we mentioned was location mapping, finding that that's really important, and to kind of make sure you're doing that on a regular basis or anytime there's a significant change. A question I was going to ask you, you really answered already, which was really, what are some changes to your HAI surveillance practices that you've implemented since participating in the validation? So thank you so much for letting us know that you guys have reviewed and you are already, taking the lead to go ahead and try to make some changes to that. So thank you so much, Chloe and Tracy as well, for being with us today. We're going to get ready to move on to the next slide, please.
Yes, so before we move on, sorry, Chloe, you were not able to share your slides. If you want to share them with the audience, please email them to me, and I will send them along with the webinar recording and slides. I see Tracy has her hand raised. Tracy, go ahead.
I just want to add, it just came to me a few moments ago. Our hospital underwent a CMS validation study a few years before you all undertook this project. And that was incredibly painful and stressful and anxiety producing. And so much better to know this information ahead of time. So what the work that you're doing is so valuable, and I don't want that to go unnoticed. I would much rather validate with VDH than have CMS ask for our records. We were fine. It was fine, but we had to do C difficile and MRSA, and it was so stressful. And yes, and you all made it so much easier. And again, knowing our problems ahead of time, it just makes it so much easier than actually having CMS look at our records.
Yes. Thank you so much, Tracy. All right. We can go ahead to the next slide. Thank you. All right, so we are so excited to share the next phase of the project. Our team will be conducting the external validation of CLABSI data, so central line associated bloodstream infections, for calendar year 2023. This project will begin this month. So communications will be sent out to our facilities in the coming week. So please be on the lookout for that. But right now, if you know that you are interested in participating, you can go ahead and complete our REDCap survey interest survey by scanning the QR code here on the screen. And also you can go ahead and access the link in the chat. Thank you, Victoria. It looks like she's already dropped that link in the chat for us, so you can also look at that. And if you have any questions regarding the validation of CLABSI, you can definitely reach out to us. We'll show our contact information coming up shortly. All right. And so that is on the screen here. So our project lead is Monica Bazar and Victoria Nichols. You can also reach out to our validators, myself, Yojin, or Cassie. Okay. All right. So we have reached the Q&A portion of our presentation. If you have not done so already and you have a question, please go ahead and drop it in the chat box. And if you're unable to access the chat, please use the raise hand function and we'll go ahead and unmute you. And I'm gonna take a second, look in the chat here to see if there's any questions already. Thank you, Andrew. I see your comment here that you really appreciate the IEP's honesty about the benefits of the participation and some of the lessons learned. Yes, yes, that has been really helpful to us.
I wish we would do calendar year 2024. We had 3 CLAPSIs last year, so that makes me sad. But I'm excited to work with you all again. So thank you.
All right, we'll give another minute to see if there's any questions. Again, if you're not able to access the chat, please go ahead and use the raise hand function and we'll go ahead and unmute you. Okay. Well, looks like we don't have any pressing questions at this time. If you do think of anything, again, you can definitely reach out to us, our project leads, or to myself, Cassia Yiljan. And I'm checking again, don't see anything else. But thank you all so much for spending your lunch with us to learn about what we've been doing here at VDH. As a reminder, the slides and the recording will be available and sent out to you all, to all the attendees. And also the statewide STEM report is available. The link is still in the chat if you want to scroll up and access it there, but it is posted on our VDH HAIAR website. All right, well, thank you all so much.
Yojan, I see your hand is raised. You want to go ahead?
Thank you.
No, it was a mistake. Sorry.
It's okay. It's okay. Just want to mention that additional communications about the CLAPSI validations will be coming to your inboxes in the next couple of weeks. So we look forward to speaking with you all. If you have any questions, you can either directly reach out to me or Victoria or one of the validators. We are here to help. Thank you so much for joining us today.
Thank you all.
Thank you all.
Bye.
Bye.